The COVID-19 pandemic has created disruption across the world and is spreading across the Caribbean. Up to Newstime Friday, Jamaica has recorded 8 cases in the matter of 3 days, and this could increase as authorities do their tracing of persons who were in contact with infected persons. Most of the cases discovered so far are imported, mostly from the UK, who already has over 600 cases thus far, with deaths reaching double figures. Schools have been closed for 14 days and the government has banned public gatherings for the next 2 weeks. Already, the storied Boys and Girls Track and Field Championship slated this month has been cancelled. The Ministry of Tourism has also suspended events for the month of March, and it would be noted to see if churches will congregate this weekend. A Scotiabank branch in New Kingston was closed immediately as it was discovered that one of the patients identified with COVID-19 visited the branch and interacted with staff there. A U.S. Embassy employee in Jamaica who also was tested positive has triggered remedial action at the embassy in Kingston. Guyana recorded its first coronavirus death after a 52-year-old woman who recently visited New York showed up at the Georgetown Public Hospital with respiratory problems and controlled diabetes and hypertension. After she died, it was discovered at the hospital that she had the coronavirus. The emergency unit at the hospital was immediately shut down and sanitized, and hospital workers who tended to the woman have been placed in isolation. The Caribbean Airlines plane that the patient traveled on from New York was eventually cleaned and sanitized, and the 13 crew members associated with the flight were placed on self-quarantine for a period of 14 days. Guyana has since beefed up its border control. Trinidad and Tobago and St. Vincent and the Grenadines are the other 2 Caribbean countries that have also confirmed coronavirus cases this week. Antigua and Barbuda on Friday also confirmed its first case of the coronavirus. Here in St. Kitts Nevis, the government, and more specifically the Ministry of Health, continues to advise persons to improve on personal hygiene as precautions to preventing the spread of the disease.
The government of St. Kitts and Nevis wishes to assure our citizens and residents that all the necessary steps are being taken to ensure that the Federation is at a high level of preparedness for this outbreak. The working group was instrumental in strengthening surveillance at all ports of entry in the Federation and in conducting a successful simulation exercise to test the alert and communication systems of our national response mechanism.
From a political standpoint, the opposition has been calling for increased measures to be taken to prepare, including seeking assistance from overseas.
Jamaica has requested from Cuba about 50 to 100 nurses, I think, because they know that their infrastructure is not such that they can deal with it alone. I know from the beginning that the only country that I suspect who can really deal with this, if this were to hit the Caribbean as it's hit in Europe, is Cuba, because it has a specific type of infrastructure and its experience from the Ebola. And I've been asking this government to call the Cubans in, bring in a number of specialists, and ask them to help us to set up the infrastructure and a plan to deal specifically with it, even to deal with those who would become severely ill.
Some personal hygiene items have been sold out, and most notably hand sanitizers in pharmacies and supermarkets across St. Kitts. Some members of the public are not sure if we are ready for the coronavirus.
The coronavirus, it is a very serious virus, but I will start in the Federation of St. Christopher and Nevis, and I would hope that there are top security measures, especially at the Robert Llewellyn International Airport, where they are screening people, especially when they come from the countries which are more prone or have been infected by the coronavirus. And also too, the cruise ships that come to the Federation, that also should be taken into consideration for security reasons of protecting the citizens of St. Christopher and Nevis.
At the moment, we are all concerned about the virus. The virus is a global pandemic at the moment. So the only thing we could do is make sure that we are as prepared as possible. And I think we should do it on an individual level. So every person should do as much as they can to protect themselves and their families. At the moment, that's all we could do. As a country, I don't think we are as ready as we can be. However, there are a lot of other larger countries, first world countries that are affected with the virus. And if them, who I think would have taken much more measures and much more precautions than we can, still weren't ready, I don't think we can be as ready.
Internationally, sporting and entertainment events have been either cancelled or postponed, including the NBA, European football leagues and competitions, tennis tournaments, and Formula One racing. Skn Newsline will continue to monitor the developments of the coronavirus locally, regionally, and internationally. Andre Huey, Skn Newsline.
Medical practitioner Dr. Terence Drew agrees that tighter screening of passengers arriving at the air and sea ports in St. Kitts and Nevis is required. Dr. Drew is an internist and candidate of the St. Kitts and Nevis Labour Party. But with the head of the World Health Organization declaring Europe as the epicenter of the coronavirus pandemic, several nationals believe that arriving passengers should be robustly screened. Similarly, with increasing coronavirus cases in our main tourism markets, such screening, it is believed, should also be applied to passengers arriving from North America. Speaking at a recent press conference, Dr. Drew agreed that additional screening should be made for passengers arriving from the United Kingdom, the United States, and Canada.
So far, I have not heard that we would have put those countries, but I really think so. When you look at a place like New York, for example, I mean, it would have some level of economic impact, and you're from New York.
I arrived on Tuesday. I was quite surprised to do nothing more than present my passport. When I arrived in Ecuador in 2005, I was breathalyzed because at that time it was, I think, SARS or whatever.
So I think this is a prime example. We know New York right now is probably one of the epicenters in the United States of America. We have seen where Governor Cuomo had to shut down certain areas to protect the population. And so they have declared, I think, a state of emergency by now. And here is somebody who traveled from New York, passed through our port, and had absolutely no type of screening. So it tells you that there needs to be more work in terms of screening. So this is a regular flight now in the tourist season. This is not even a yacht. I would tell you another thing. I got a call about 2 weeks ago from a gentleman who told me that people came off of a yacht, I think it was over at the Southeast Peninsula, and no sort of checking went on. And he's very, very, very concerned how people can just come through, and there were no checks. So we still need to tighten our border security, and we need to look closely at countries, especially places where we know there are cases and states of emergency or state of emergencies would have been declared so that we can continue to protect our population. But as I say again, we need to ask, without saying much more about the deficiencies or anything like that. I think there's always room. We still need to ask for help. We need help.
Up to the time of our news deadline, Skn Newsline attempted unsuccessfully to contact the Chief Medical Officer for comment on this matter. Glenn Barth for Skn Newsline.
At Nagico, the things that matter to you matter to us. Like knowing you're covered when your house gets flooded, getting your settlements quickly and fairly when a fire hits your home, and making sure your business can keep going even after an accident happens on site. At Nagico, we're about much more than just insurance. We're about the big things and the small things that mean everything.
Scan this. Boy, what that stand for?
We are Skn and Nevis Waste Disposals.
Oh, so it's I just rent the big bin for when people clean in the yard and construction project and so?
Yes, we do that.
Okay, so what about septic tank and grease trap cleanings?
Yes, we do that.
Them portable toilet rental?
Yes, we do that.
So what about if I want to rent a sexy bar trailer for like VIP events or my outdoors wedding?
Yes, we do that.
Residential garbage pickup?
Yes, we do that.
Okay. So if my office have a bunch of documents we need shredded?
Yes, we do that.
Boy, I talking to you and you know, but when you answer me, I hearing like 10 people.
That's just the strength of our team working for you. Watch now.
Call us at 662-3329 and we'll come and do that for you.
Like us on Facebook.
Attorney General Vincent Barron has disclosed that in light of the court ruling which stipulates that opposition leader Dr. Denzil Douglas must vacate his seat as Member of Parliament, the opposition will now have to put forward a new opposition leader.
The Constitution requires that there shall be a leader of the opposition in the National Assembly, who shall be appointed by the Governor General. With today's ruling, and as Parliament is likely to meet over the next few weeks, the Governor General shall appoint an elected representative to the position of the Leader of Opposition, who appears likely to command the support of a majority of the representatives who do not support the government. The power to do so shall be exercised by His Excellency the Governor General in his own deliberate judgment.
Mr. Barron said the development is unprecedented in the history of St. Kitts and Nevis.
Today's judgment has produced an unprecedented chapter in the annals of our young and proud nation. Never before has any member of Parliament in the history of St. Christopher and Nevis had to vacate his or her seat for any reason, and we hope it will never happen again in our future.
The Court of Appeal ruled on Thursday that Dr. Douglas, Member of Parliament for constituency number 6, is required to vacate his seat with immediate effect as a penalty for ignoring the law set out in the Constitution in relation to qualifications for being a Member of Parliament. This because he possessed a diplomatic passport from Dominica. Dr. Douglas said while he's surprised by the ruling, he accepts it.
The judgment does not preclude me in any way from seeking re-election by the people of constituency number 6. My own colleagues, only a moment ago, have all endorsed what has been the position of the people of constituency number 6 of the Labour Party, that Denzil Llewellyn Douglas will stand again as the candidate for constituency number 6 when the elections are called for the St. Kitts Nevis Labour Party.
Andre Huey, Skn Newsline.
Internist Dr. Terence Drew is calling on the government of St. Kitts and Nevis to get help from Cuba to set up a strong medical system to deal with the coronavirus or COVID-19. With St. Kitts and Nevis designated a high-risk country for the importation of the disease, Dr. Drew urges a robust national response to the coronavirus pandemic using the expertise of the medical community of Cuba because of their experience with dangerous infectious diseases. Dr. Drew also is a candidate of the St. Kitts and Nevis Labour Party and spoke in response to questions from the media regarding COVID-19 at a recent press conference. Regarding preparations that should be made, Dr. Drew made the case for urgent additional support.
We don't have an infectious disease specialist who is a specialist who deals with infections. We don't have a lung specialist or pulmonologist who would deal with most of the severe complications as a result. And we don't have an ICU specialist, so to speak. And therefore, I had asked the government, and Jamaica is now doing it. Jamaica has requested from Cuba about 50 to 100 nurses, I think, because they know that their infrastructure is not such that they can deal with it alone. I know from the beginning that the only country that I suspect who can really deal with this, if this were to hit the Caribbean as it's hitting Europe, is Cuba, because it has a specific type of infrastructure and its experience from the Ebola. And I've been asking this government to call the Cubans in, bring in a number of specialists, and ask them to help us to set up the infrastructure and a plan to deal specifically with it, even to deal with those who would become severely ill. One case can shut down the country to a great extent, or parts of it, and therefore I am saying that the government needs to bring everybody together. We need to have a more strategic, more succinct health plan and ask for help. Ask for help because we know the infrastructure that we have here in health cannot sustain this. I'm going to say it again. The government needs to ask for help now. We cannot be over-prepared. If we don't get a case which is least likely, and we would have been prepared, good. We're in good standing, and the experience would help us for the next one, because the next one will come. It's just reality. But how we stand now, there are some gaps, even though I know there are people in the Ministry of Health and the health workers, doctors, nurses, they are very alert and they want to work hard. But from the top, I am saying to this government, we have gaps. They have to be filled. Ask for help and get everybody on board. And silly statements like people are making politics out of this is exactly what I said. It's a silly statement. We need to get prepared.
Dr. Terence Drew, medical practitioner and candidate of the Skn Newsline Labour Party. Glenn Bart for Skn Newsline.
You care about what goes on your skin. You care about the ingredients, organic and natural products. We have Rituals brand, Victoria's Secret, and much more. Discover the collection of prestige natural beauty. There are too many chemicals. Time to change. Go to Lucky's Duty Free at King's Pavilion Hotel on Bay Road, Bastille. Treat yourself as a princess. Also, Bath and Body Works coming soon. Check us out on Facebook. Open hours are from 8 a.m. to 7 p.m. Give us a call, 466-7059. Lucky's Duty Free.
Quality Diagnostic Laboratory, your newest partner in your healthcare. We offer the latest in on-island clinical laboratory testing. A comprehensive range of blood tests, urine tests, stool and other testing such as cholesterol and sugar testing, as well as hormone, kidney and liver functions, and many more. Quality Diagnostic Laboratory is located at the corner of Keon Street and Fines Avenue, opposite the Greenlands pasture. Our opening hours from 7 a.m. to 4 p.m. Monday to Friday are designed with you in mind. We are also open on Saturdays, 7 a.m. to 12 p.m. for your further convenience. Call or contact us at 465-6657 or email us at info@qualitydiagnosticlab.com. Quality Diagnostic Laboratory. Excellence in performance.
Banners, commercial signs, decal printing, canvas prints, license plates, posters. We at Multigraphics are dedicated to providing quality products and service to our customers. Our team takes pride in the craftsmanship and is passionate about its work. Every job, large or small, is important. Most of our customers come to us through referrals. That's because our number one priority is service. We serve a wide variety of customers, such as restaurants, retail stores, manufacturers, trucking companies, and many more. Our capabilities include design, production, and installation. How can we help? We are located at Bird Rock at the Woods Right compound. Call us at 869-763-1511 or 784-491-7599. Multigraphics.